Good afternoon, everybody. At the outset, I would like to thank you all to be in this triathlon team. So, how is the Zos? How is the Josh? I think they are high on chocolate. Am I right? Yes. आवाज नहीं आ रहा है? Yes. अरे, you all are into the triathlon championship, so we need some noise. Yes or no? Yes. That's it. Yeah, noise carries marks. Okay. Okay. Yeah. Your teammates, your friends are here to come and cheer you. You can see them. Okay, without wasting time, I would like to tell you all that for the first time, we have Dr. Sandhya, our secretary from BOS, who is here. And for the first time, we have actually initiated this concept of triathlon for the postgraduates, where you all know that it is a triathlon means 3 events, which are the quiz, which you all are now participating. Second will be the Insta Reel, and the third is the talent show. So for this, we have told you all that there are minimum 3 people, maximum 5, and for quiz, 3 people are allowed. I'm sure you know the rules of quiz. Dr. Vivek Bhaskar, who is the quiz master, and his team will tell you in detail. But from the triathlon championship, after this event, the top 3 will be scored for 100. Okay, then after that, the consequent event is the Insta Reel, which you all have prepared and sent, which will be judged by a different team of judges depending on the criteria given, and in that also the top 3 will be scored for 100. And the last will be the talent show, in which, as we said, more than 3, 5 or even 1, 2 you can, and that time you can do more than 1 event also, but your speculated time has to be maintained. That is also scored as 100. So total of 300, then the champions will be announced. You understand? But we want to be very, very good to you. So for every event also, you have prizes. For every event, we'll have the team who wins the quiz, a team who wins the Insta, the team who wins the talent. Okay? Is that good to go? Yes. Okay. So thank you, and all the best to all of you.
All the very best, and there are lots of chocolates to be given. So remember that also. That will go to individual, each of you, whoever answers. Don't keep looking at each other's face and ye answer karega, ye answer karega. You know, buzzer dabao, and lots of hangama I want. Some noise. Come on.
Yes. And see, we have been very fair. We do not want to disclose the institute name. That's why we have been given. I'm sure you all know. I'm sure none of these are the questions for them, no sir?
There might be.
They might be. So if you have done some thesis on Duke Elder, how many volumes of Duke Elder? 7. Oh my. 0. Minus marks?
Yeah. Who was that? They will start with -10.
Okay. So that's right. Just ensure that in all the 3 events, the institution name should not be disclosed. Okay? So that it's a fair thing. Okay? All the best.
So just check your buzzers, guys. It's working, right?
Just wait. I'll give you the cue. Whosoever can press, and then we'll realize who has pressed the first. Okay? Let's see. Fastest fingers first. 3, 2, 1, go. Oh, okay. ಅಲ್ಲೂ ಅದು ಕೊರಾಬ್ರೇಟ್ ಆಗ್ತದೆ ಅಲ್ಲೇನು ಬರಲ್ಲ. So you got the point, and our decision is final.
It's working.
You can't keep pressing it. You can't keep pressing. It's not your phone. It's a buzzer.
Everything is working. Once it's taken over, that one goes. Okay, stop playing with the buzzers. It's working.
Now no pressing.
No more pressing.
If anyone presses, -10 again. Already they have scored -10.
So please see the rules before each round, okay?
Am I audible? Yes. ಇದು mic on ಆಗಿದೆಯಾ? All right. Audible. Was the food edible? Good. Did you eat? All right. So let's start the first of the triathlon. That's the PG quiz. All the best. I'm Vivek. I'm a retinal surgeon practicing at Shekhar Eye Hospital. My team members, Vinita, she is into cornea. Priyanka, another retina specialist. And Swati, oculoplasty. So we four will attempt to torture you people. Let's see how successful we will be. All right. So good luck. So the first round, there are actually 3 rounds. The first round will be the nerd round. I see a few nerds over here, which is good for us. We need doctors who need to be serious. We can't be munna bhais all the time. So the first round will be a nerd round. 2 questions per team. So in this order, from left to right, and then again right to left, we'll go. If the team to which the question is addressed, if they don't answer, it will only be passed once, and that too on buzzer. And the buzzer has to be pressed as we ask the question. You can't, like, once they give the wrong answer, then you can't press the buzzer. Do you get that? All right. And then +5 for the correct answer, +3 for the pass question, and -1 if you press the buzzer and get the wrong answer, it will be -1. So don't be buzzer happy, don't be trigger happy. So we are very strict, as you see. Yeah. See, I'll give you an example. I'm asking a question to layman.
Okay, sir.
I think you can.
When the question passes, you press a buzzer, then we tell who has
Okay.
pressed, and then you answer.
Okay.
If you answer correctly, +3. If you answer wrongly, -1. Okay?
Okay.
So if the if the team that the question was meant for, if they answer it wrong, then you will tell that it's a wrong answer, and then it will pass,
You
or
have to pass, yeah.
and then again the buzzer thing will start.
Yes.
or-
No.
No.
That should not be the way.
Okay.
The moment I ask the question, the direct team will obviously get the right to answer, and there is no negative marking for that team per se. Okay?
Okay.
But by then, all the other teams should have pressed the buzzer. You don't get the chance after the direct team gets the wrong answer. I don't want that to happen. Because there are only 4 choices and you're deleting 1 choice. So the next thing will be easier. No, I
Okay.
don't want it to be
Okay.
easier
So
on you.
the moment the question comes, if the question is meant for us, we won't have to press the buzzer, because but other teams will have to
Yeah.
press the buzzer immediately.
Apart from payment, everyone else can.
Got it.
All right? No doubts. So let's start. Good. So what is the most common form of inheritance in cone rod dystrophy? The first question is to Gulstrand. Cone rod dystrophy, whether it is autosomal dominant, recessive, X-linked recessive, or sporadic. So the others can press the buzzer if you already know the answer. Yeah.
Makhima team has pressed the buzzer, but hold on.
You will get the chance only if they give the wrong answer.
The time
Is
20 seconds.
Autosomal recessive, option B.
that right? Yes. Yeah. So they have
+5.
opened the account.
+5 for Gulstrand team.
All right. I hope you have all read about OSSN. Which of the following is not a routine technique in OSSN? Excision. We do a 4-step approach to remove the tumor. We minimize intraoperative seeding with all measures that are possible. We liberally use balanced salt solution to flush the tumor cells. And we also sometimes use amniotic membrane, conjunctival autograft to close a large conjunctival or a scleral defect. Buzzer is open. Wait.
So option C, liberal use of balanced salt solution to, we don't do that.
Correct. So because while you use the balanced salt solution, you can actually lead to tumor seeding. So you don't do that. Good.
+5 for payment.
So let's go to Chandler. So you'll have to crack jokes now. Yeah. But maybe these guys are very young. Have you seen Friends? Yeah. Do you have friends? That was Chandler. Okay. All are true of 1.5 syndrome. 1.5 syndrome except characterized by unilateral gaze palsy with internuclear ophthalmoplegia. Lesion is in the parapontile reticular formation, abducens nucleus, and middle longitudinal fasciculus. Vascular insult is the most common cause, and it generally causes irreversible diplopia and oscillopsia. Buzzer? Anyone else? 1.5 syndrome. Now it is 2.5.
Okay, hold on. Yeah, Duke Elder has pressed the buzzer. So we are looking for an answer from Chandler team.
Chandler.
Option A.
Option A? That's wrong. Yeah.
So Duke
Duke
Elder.
Elder.
Option D.
Option D. Correct. Option D is the right answer. They get +3. Duke Elder
Plus
gets
3 for Duke Elder.
See, the 1.5 syndrome is basically the same thing. Unilateral gaze palsy. One eye doesn't move and the other eye doesn't move half. That is why it is called 1.5 syndrome. Alright? And vascular insult is the most common cause, PPRF, MLF and abducens nucleus. That is the area in the midbrain or the brainstem where generally the insult is. It usually settles down by around 6 to 8 weeks. So it is that generally doesn't cause irreversible diplopia or oscillopsia. So that was a good answer, Duke Elder. Let's go to Ridley. Ready to solve some riddles? Alright. So all are true about progressive outer retinal necrosis, except inflammation is severe, can be caused by varicella zoster or cytomegalovirus, seen in severely immunocompromised patients, and earlier on it affects the outer layers of the retina with vascular sparing, giving a cracked mud appearance. Buzzer is open.
Chandler has pressed the buzzer, but hold on.
No. Ridley gets the right.
Pressed first. It got on and then
Okay,
off.
we'll do that again, but this time we'll just take that. Okay. I'm sorry. Yeah, Ridley gets the direct question. Time. Okay. Sorry? Good. You don't lose anything, so you can answer.
Sir, A. Inflammation is severe.
That's the right answer. See, there are two clues here. See, many a times quizzing is not about knowing everything. It's about deducing as well. So apply your mind. We are not your teachers. The four of us are not your teachers. So you don't have to be afraid. No need to be scared. All right. Either one of these two, A and C, both can't be correct. You can't have a severe inflammation in a severely immunocompromised patient. It's common sense. Okay, so either one of them has to be right. And the photograph that you're seeing, the media is absolutely clear. So then you don't have severe vitritis. So then there is no inflammation. That's the reason. Inflammation is almost minimal. You don't get vitreous cells. Whereas in acute retinal necrosis, where the same viruses cause the problem, it causes severe pain, severe vitritis. It's almost like that. What is the other disease where you get the fog in the, the light in the fog appearance? Like that, you can get it in ARN as well. Although ARN generally causes peripheral vasculitis initially and then progresses posteriorly. Here it is mostly posterior. Right? So that's the good answer. Deducing is also important. You may not know most of the things or many things. It's still fine. So next question is to Jules Gonin. Identify the false comment regarding immunosuppression. Immunosuppression as such, overall. Corticosteroids are inevitable. Cyclosporin and tacrolimus can be used for fast action. Azathioprine is an affordable option if tolerated by the patient. And mycophenolate mofetil can be used when urgent immunosuppression is needed. So Jules Gonin gets the direct thing.
Answer is B. Cyclosporin and tacrolimus can be used for fast action. It's false.
That's the wrong answer. Are you sure that Chandler pressed? Okay, but we will overrule this because the Chandler's buzzer is just... No, but I think she's still watching. Their buzzer isn't working. So she watched it. And last question also she had actually told me that. So now I'm overruling that and giving the opportunity to Chandler.
Option C.
Option C is also the wrong answer. You'll get a -1. Mycophenolate mofetil as a drug, as an immunomodulator or an immunosuppressant, takes time to act. In fact, there is a lot of variation in the initial thing. So it isn't used as a primary drug to cause, to initiate the immunosuppression. It takes time. So initially it is mostly either you use steroids or these other faster acting drugs, adalimumab, even those drugs, particularly for the eye. Okay? But the other things are quite evident, I guess. no matter what we do, corticosteroids cannot be avoided, so we have to go through that. Mycophenolate mofetil, anything beyond 12 weeks is considered reliable. Until then, the effect of MMF keeps fluctuating. Okay? So, the next question is to Duke Elder. Yeah, identify the odd drug. There are 4 drugs here: levocetirizine, topiramate, aripiprazole, and paclitaxel. So
Yeah, but
the
payment
direct
is paid, pressed first. If you
direct
press, I'll
goes
tell.
to Duke Elder. If they don't get it, then payment gets a chance.
If they press first, you won't be able to press. That is the problem. Okay.
A, levocetirizine.
Levocetirizine is the wrong answer.
So
Payment.
payment.
Option D, paclitaxel.
Why?
So it is it's a anti-cancer drug. It acts on.
What are, but why are we asking in an ophthalmology question? If it is an anti-cancer drug, then the others are not. But the others are
Others
what kind of other drugs are there? Your answer is right, but I want the reason. Because then you will only get 1.5 marks. What? I mean, topiramate is probably most common amongst the other 3. What does topiramate cause as an ophthalmic side effect?
Drug-induced angle closure.
Angle
Other
closure.
two also causes
Yeah,
angle closure.
angle closure,
glaucoma.
yes, yes.
Whereas paclitaxel causes open angle glaucoma.
Okay.
It causes trabecular measure fibrosis leading to secondary open angle glaucoma.
Yes.
Alright, that's how it is different from the other 3. Alright, so the next question goes to,
How many points for payment?
we'll give him 3.
Plus 3 points
He's
for
a nice
payment.
chap. I like it. So the next question goes to McKimmon. Yeah. Which of these is not a measure to control progressive myopia in children by causing peripheral defocus? See, there are too many specificities here, so please read the question properly. Orthokeratology lenses, low-dose atropine, spectacles with incorporated lenslets, and soft multifocal contact lenses. McKimmon, and then Gulstrand is on the buzzer. Anyway, they will get 30 seconds.
It's only one pass.
Sir, we'll go for option D.
Option D, soft multifocal contact lenses. That's the wrong answer. Then Gulstrand immediately, quickly. C is also the wrong answer. They get the -1.
-1 for Gulstrand.
Anyone else without?
So option A.
Option A is also the wrong answer. You will get -5. You have let me down. I was favoring you. Huh? अरे बाजार में नीलाम कर दिया मैंने. No, it's low-dose atropine, man. The others are all working through the peripheral defocus. Low-dose atropine doesn't cause that. I mean, it doesn't work that way. Although it is used as, it is in fact one of the most reliable measures to halt progressive myopia in children. The others aren't that reliable. They are still like under study and all that. So, but the mechanism of action is different. See, that's why I told you when I was reading the question, there are 2 or 3 specificities. All of them are important. All right. So, I think we are done with one round. Now we will go the other way. Before that, we'll have 2 questions for the audience. Can we? Yeah. All right. What type of rejection is more common in DALK than PK? Endothelial rejection, epithelial rejection, stromal rejection, and subepithelial rejection. It's
So
for the audience.
one of you have to raise your hand.
Yeah, he did. And stromal rejection. Can someone hand over a chocolate? Well done. Are you a cornea specialist? Oh, you are a PG. Give him one more chocolate. Okay, another question to the audience.
Raise your hand.
What cause of leukocoria is associated with microphthalmos? Persistent fetal vasculature, infection with Toxocara species, Coats disease, retinoblastoma. Microphthalmos with leukocoria. Both are important. Specificities. ಅವ್ರಿಗೆ ಚಾಕ್ಲೇಟಲ್ಲಿ 1 ಪೀಸ್ ಮಾತ್ರ ಕೊಡಿ ಕರೆಕ್ಟಾಗಿ ಹೇಳಿದ್ರೆ. ರಾಂಗ್ ಆನ್ಸರ್. ಅವ್ರ ಹತ್ರನೇ ಚಾಕ್ಲೇಟ್ ಇಸ್ಕೊಳ್ಳಿ. He's giving the answer.
Ports disease.
ಅವ್ರ ಹತ್ರ ಇನ್ನೊಂದು ಇಸ್ಕೊಳ್ಳಿ ಅದು. It's persistent fetal vasculature. All the others are kind of acquired causes or reasons of leukocoria. They don't come with microphthalmos. Microphthalmos is associated with persistent fetal vasculature. All right, ಎರಡು ಚಾಕ್ಲೇಟ್ ಬರಬೇಕು ಆಡಿಯನ್ಸ್ ಇಂದ ನಮಗೆ. Okay, now the reverse order. Macamar gets the first question. Are you ready? Yeah, there are no music like KBC and all that. Huh? What organization? Sandhya? No music here.
If I start talking, then you have to leave the stage.
No, I'll face that music. No, I don't want them to. Anyway, next question. When a patient focuses on near objects, the lens zonules, what do? Contract, relax, rotate, twist. Oh my God! That should be in your Insta reel, not here.
She's devastated.
They contract, sir.
That's the wrong answer. Jude's gone in. Relax. That's the right answer, and
Plus 3
gone in
for
gets
Jude's
plus 3. She was there last time also. Hey, how many years of PG are you doing, yeah? Huh?
She's there everywhere.
Just say as long as you're with this master.
Anyway, don't take it anywhere. I know you're a bright student, so obviously you're not failed. Huh? So the next question to Duke Elder: identify the correct statement about keratoplasties in India. Specificities again. Fuchs endothelial dystrophy is the most common indication. Lamellar keratoplasty outnumber penetrating keratoplasty by a narrow margin. We have the maximum number of eye banks, and the corneal utilization rates in India are in the range of 80 to 90%. Duke Elder, and then the buzzer is open. Deduce.
Chandler has pressed the buzzer.
Monica is waiting.
Option C.
Sorry?
Option C.
Option C is the right answer. You are right. We have actually the maximum number of eye banks worldwide. India has around 300. 293 probably is the exact number. We have the maximum number of eye banks in the world in terms of country. What is the most common indication of keratoplasty in India? PBK or therapeutic. You can even say therapeutic. Perforating corneal ulcers and all that. And LK outnumber PK by a narrow margin? No, PKs are still more common. KK, PK, and it's okay. And corneal utilization rates? Approximately how much? 40 to 45%. That is our corneal utilization rates. Interesting question? Yeah, thanks. As if I did everything. Yeah. The next question is to Jules gone in, no? Density of rods is greatest at what degree of fixation? 120, 90, 12, 0. Question देखने के बाद 60 भी चाहिए होगा.
Payment has pressed the buzzer.
Okay. Good.
Sir, option A, 120.
No. Yes, payment.
90.
What man?
Minus
He told you
3,
the answer?
minus 1 for payment.
1 to payment. It is 12 degrees. It is 12 degrees. See, most of our vision is right in the center. The cone is in the center. Rod vision is also around the center. The rest are all, it's just shape or what you call spatial recognition. It's not vision. Okay, there are different facets to our vision. What do you assess when you are reading the Snellen's acuity? What part of vision are you assessing? Recognition. It's called as recognition. Then there is something called contrast and visual fields and all that. These are all different aspects of vision. It's a very interesting thing. You should read. What is that squint wala book? The Von Norden. Von Norden. Have you read Von Norden? You should, just for the heck of it. Particularly the first 30-40 pages, which explains to you about the physiology of vision. You might not do much about it. I have not done anything after reading that in my retina practice. But the nature is so beautiful. one has to read all such things to actually understand how fortunate we all are. Okay? Most of us don't have any congenital malformations and all that. See, there's so many things which can go wrong with all of us. But despite that, we are all in proper shape and size. Huh? So we should consider ourselves lucky, fortunate. Alright, so read that. Read those first 30, 40 Physiology of Vision, Von Noden and all that. Good books are there to be read. Not for exam, not for scoring marks. That inevitably will happen. And you didn't ask me, what right do you have to be the quiz master of our quiz? How much marks did you get? No, you don't know. I might have been a failure. So it doesn't matter. So study good books, study well. Alright? Gyan. What is the most common complication of a conjunctival flap? The question goes to Ridley. Epithelial inclusion cysts, flap retraction, hemorrhage beneath the flap, and ptosis. The direct question is to Ridley, buzzer, Duke Elder.
Flap retraction.
That's the right answer. Good. We need some more claps. You are not in their college, not in their institute. That's why you are not clapping. That's so mean. Okay, next question to Chandler. Identify the true statement about netarsudil. The mechanism of action is similar to that of prostaglandin analogs, known to cause cornea verticillata. Conjunctival hyperemia tends to worsen with continued application, and the IOP lowering effect is better than timolol but lesser than prostaglandin analogs. You need to identify the true statement. Chandler, one thing to say is like there are 2 or 3 quasi correct questions. Which is the more right one you need to identify? Chandler, and then on the buzzer is payment.
Option C.
Option C, conjunctival hyperemia tends to worsen with continued applications. Is that the true statement? Okay, it's not the true statement. Payment? उनका भी वही जवाब था और तो अदे आंसर he is letting me down again. No, please have mercy. हो गया टाइम तुम्हारा.
Option D, the IOP lowering effect is better than timolol, but less than.
मौके पे चौका. That's the right answer. I am asking you to identify the true statement. The true statement is that it is better than timolol but less than prostaglandin analogs, and hence it, in select cases it can be used as a primary drug. Our glaucoma specialist is approving. Nobody can say anything. I have to send my patients to her. Okay. So the next question to Gulfstrand. Ready? What? Oh, okay. Sorry. Payment. Okay. Identify the true statement about anticoagulants in ophthalmic surgery. Specificities again.
Has pressed the buzzer.
Minimal or no risk of bleeding cataract surgery. Patients on dual antiplatelet therapy should be moved to low molecular weight heparin. Patients with atrial fibrillation or deep vein thrombosis have to be continued with anticoagulants and bridging therapy as well. The risk of post-operative vitreous hemorrhage is equal among coronary artery disease, chronic kidney disease, and cerebrovascular disease, which is the correct statement, the true statement. Payment, and then Duke Elder is on the buzzer.
So option B, patients on dual antiplatelet therapy should be moved to
That's the wrong
low
answer.
molecular.
You also wanted to answer the same? -1 लिख लो, जो भी answer
Option C.
Huh?
C.
Option C. Wrong. -1 to Duke Elder. Come on, yaar. How many of you have operated on cataracts?
None.
Is the bleeding more? Then? Particularly when you do a clear corneal surgery, where is the risk of bleeding?
So, but they've not mentioned.
What? Cataract surgery nowadays nobody does ICC. SICS also you can manage the bleeding here. Come on. Don't be so hard on me. Huh? Okay. But see, minimal or no risk of bleed in cataract surgery is the right answer. When you are on dual antiplatelet therapy, you can stop one. Generally, these days, clopidogrel and aspirin. You stop clopidogrel, continue with aspirin. You have another Rivaba something, not Ravindra Jadeja's wife. Okay, someone else. So you stop that and still continue with ecosprin. So like that you can do that. And with atrial fibrillation and DVT, you need to be really very careful because they are at very high risk of throwing clots all over the place. They can even probably infect the next bed person also. The risk of post-operative vitreous hemorrhage is more in cerebrovascular disease when compared to CKD and coronary artery. So the last question in this round to the PGs will be to Gulstrand. Mitomycin C, all are true except it is used in glaucoma surgery, refractive surgery and OSSN. It's a cell cycle independent drug. It's given in cycles to prevent toxicity. The side effects are less common than 5-fluorouracil but more severe. Gulstrand direct question, Duke Elder buzzer. It's a cell cycle independent drug. Yeah, that's the right answer. Like I said earlier in one of the other questions, there are two clues here which are contradicting each other, B and C. We all know that it is given in cycles to prevent toxicity, and it also is given in cycles because it is a cell cycle dependent drug. It works only in the which phase of cell division? Which phase? Mitotic phase. Why are you scared? I told you I'm not your teacher. So, she's but it works only in the mitotic phase of the cell division, isn't it? Mitomycin C. All are true except, yeah, they are false. It's a cell cycle dependent drug. Okay, so one question or two questions to the audience? Three na? So, audience will have three questions again. So, now, non-ophthalmic. Which Indian actor has acted in the most number of movies? Sri Kumar, Brahmanandam, Amitabh Bachchan and Manorama. No, wait. Please don't give us the answer.
We got one person who has raised the hand. Order, please answer one by one.
Who's the one? Yeah.
Dr. Pooja. Brahmananda? Wrong answer.
No.
sorry.
That was a good comedy. Huh?
Any one person we can ask now? Yes. Correct. Give her the chocolate.
Madam, Manorama, she is a South Indian actress, basically a Mallu.
You all went for colored, no? Black and white was the answer.
Yeah, she's been from those days. Jaise A.K. Hangal has been old from the beginning. When he was born itself, he came like, "Itna sannata kyun hai bhai?" So like that was how he didn't cry. He came out saying, "Itna sannata kyun hai bhai?" Which movie is that? Odd man. So many people are taking so much time. Ramurthy sir answered. Sir, super. Next question to the audience. Which is the
raise
fastest
your hand.
growing consumer application of all time? Fastest growing consumer application of all time. Google, Facebook, ChatGPT, TikTok.
Yes, correct answer.
ChatGPT.
ChatGPT.
ಅವ್ರಿಗೆ ನೀವು ಕೊಡಬೇಕಾಗಿ ಚಾಕ್ಲೇಟ್ ವಜಾ ಆಗಿದೆ ನಿಮ್ಗೆ ಸಿಗಲ್ಲ. Okay, the last question to the audience. What has been the highest recorded temperature in Bengaluru? 38.2, 39.2, 40.1, 37.1. Wait. Don't shout the answer. Okay, yeah.
That's the wrong
But
answer.
then
One
it's
more.
the wrong answer.
You already got it. You already got it.
Hey,
Please. Kindly don't argue. We have said the answers, so that is the correct answer.
it is booked. See, 40.2 was in Devanalli International Airport. It was not in Bangalore. That is why it is 39.2 in Bangalore.
So this
IMD has, temperature recognition in different places. In Bangalore, it was 39.2. All right, so that concludes the round one.
So this
Now I'll
picture
hand
was in
over.
2016, by the way. Whenever it was too hot last few days, it never crossed 39.2.
All right.
Well, once you got out of the room.
Over to Dr. Vinita or Dr. Priyanka, whosoever.
Yes, we'll not announce the score now. We don't want to put pressure. Is that fine? You want the score? They want the scores.
But we won't give. So after an intense round, the bad guys are here. Okay, so this is a pure entertainment round. Okay, you don't have to worry about your Kanskis and Janovs and Jacobis. Okay, this is a pure buzzer round, which means all of you have to pay attention to your buzzers. There's only one person who gets to answer this amongst the teams. You get 5 points for the correct answer. You get -2 for the wrong answer. So if you've given a wrong answer, it doesn't go to your fellow team members. It goes directly to the audience. Right? Any doubts?
And the time is 30 seconds again.
You get 30 seconds time to answer. Yes, directly a buzzer. So whoever has not scored well in the last round, this is the time to redeem yourself. Right? 30 seconds to answer. Once
After you press the buzzer, you get 30 seconds. The timer starts. Okay? No,
Correct.
The timer will start as soon as we see the
You have
buzzer.
to finish the answer in 30 seconds.
Finish answering.
Aisa. Shall we begin?
Everyone's buzzer is working. If you press once, others' buzzers will stop functioning, okay? Shall we start? The first question.
Payment.
Payment. Your time starts now. Name 3 Kannada or Hindi movies based on visual impairment.
One is black.
Okay.
Timer
26 seconds. 24.
Andhadhun.
Okay.
One more.
Come on. 12 seconds.
Sholay.
ये कौन सी वाली शोले देख ली आपने?
Ma'am,
Just made Gabbar Andha, I think.
ये राम गोपाल वर्मा का देखा है.
-2 for payment team. Now the question goes to audience. No, you. One chocolate for her.
Chocolate for her, please.
Okay.
This
Next
is
question.
easy.
Best-selling author who is also an ophthalmologist. Lewis Carroll, Robin Cook, Arthur Haley, or William Blake.
option B, Robin Cook.
Correct. Yes, that's right answer.
Plus
Plus 5.
So what is the common factor between the three people?
Buzzers charge, please. Buzzers charge.
Maybe it wants you only to answer. Okay. So what is common between the three of them that you're seeing over here?
Wait. 3, 2, 1. You can press.
Start.
They're all old people.
Please give her a chocolate for this. She's the most entertaining.
-2. If it was in my hand, -10. Outrageous. Okay, anyone from audience, please? Come on, anyone from? No, sir, you are not allowed anymore. Yes. Yes, ma'am.
It's a random guess. I'm guessing spinsters are.
Zohra Segal's grandchildren will be very upset.
Anyone else from audience?
The questions have got
All very powerful
something remotely
Powerful,
related to
agree,
you.
but something more than that. Yes, related to the eye. All the questions here
You
are
want a clue?
entertainment and eye.
You want a clue? Clue
Absolutely. Clue is
Yes.
sitting here.
The
clue is
glaucoma
sitting here.
champion has answered. So that is Dr. Ramanjeet Sihota. This is Zohra Segal, who suffered from congenital glaucoma. Okay, and she's Upi Goldberg. She's also a known case of glaucoma. And Dr. Ramanjeet is a glaucoma specialist. So glaucoma is the answer. So
This former international cricketer lost his eye to trauma. Buzzers. Buzzers. Buzzers.
Please
Teams.
see the
Please see the
picture.
question.
The picture could be a clue.
Duke Elder.
Pataudi.
Sorry? Say loud.
Pataudi.
Pataudi. Correct. +5.
Do you know anyone else looking at the picture?
Yes. 1 chocolate for him also. Okay. Name 3 songs with the word aankh.
Jules Kunin.
Jules gone in.
काली काली आंखें, गुलाबी आंखें,
And
पानी दा रंग दे.
oh, Akhiya do anjo. Correct. Yes. +5 for the team. So recently, this public figure underwent vitrectomy in
Gulstrand.
United Kingdom. Gulstrand. Absolutely right. +5 to Gulstrand.
Yeah, I like this question. Which ocular structure does she remind you of?
Sorry to be racist, but sclera because she's white.
Hey, this one is take back her. Who is she?
Who is she
The
and what
answer-
does she remind you of, audience?
Dua Slayer.
Gulstrand. Gulstrand.
That's Dua
Gulstrand.
Slayer. No, no, ma'am. No, Makima answered it wrong, so Makima gets -2. You don't get any points because it's not passed for the teams. Chocolate, yes, for everyone. And chocolate for madam.
Now, at the cost of making the answers entertaining, don't rob others of the right to answer.
Who is this 5-time Olympic medalist? Look at the images and try to identify. Buzzer. You can look at the medication being prescribed by our sponsors for this event, His Highness people. The Aquim gel, Aquim eye drops. Does it give you any clue? There are some images at the end. None of the teams?
Okay, clue.
Can I?
Yeah.
Her father's role was played by Will Smith.
Yeah, that's a good clue. There's a movie made on her.
Okay, Duke Elder has pressed the buzzer.
Serena Williams. Or
The other one.
Venus.
No, what do we do now?
Venus.
We give them.
Give it to them.
Yeah.
No. The teams differ. They're like, don't give it to them.
The quiz master decides.
Because he has let me down. So
No, he is not.
Okay, so do we give them or not? What are we doing? We are giving. Although I would not. Anyway.
only half is right.
I like this question. Name the ocular condition associated with this item. Buzzer teams. Gulstrand. Huh? Swimming in powder?
Oh. You have to appreciate
Nice.
her.
I like that creativity. Yes. No, that's not right.
What is it?
We can give them something for the
You
imagination.
can get chocolates for this. For sure.
2 chocolates. Yes, ma'am.
very
There are so many
creative people.
interpretations.
But the person who's prepared this question will not be happy. She's not
Shall I give
approving.
the answer? Anyone else from audience ready to try this? Talc retinopathy. Sorry. What? Whoa.
You are all with the three of us. All the three, we gave the same exclamatory remark.
But Malika Dua was also my question.
Malika Sharwat was mine.
She did not make it.
The next question was on the screen. You just missed because of your.
Sir Arthur Conan Doyle.
Yes, sir. +5 to payment. Yes. Now the finale round will be taken over by Dr. Vinita. Audience question at the end. We'll do few.
So all is not lost yet. Everyone can still win. Lot of points to score. So we'll not still reveal the scores. Scores will be given in the end. So yes. So this now finale will have 2 rounds. I'll tell you the rules soon. So the first round is this. So just go through the rules, same as the first round. Okay. So direct question +5. Everyone presses the buzzer, +3 for the pass question and -1 for the wrong answer. Is it clear? Shall we start?
All of you will get your questions. Okay? You press the buzzer for somebody else's team.
Am I audible? So are you all ready? So nobody is losing yet. So why do I see depressed faces? All of you please be, yes, please be happy, please be josh mein, okay? So shall we start? Yes. Shall we start or not? Yes. Can't hear you all. Yes. At this side I can't hear anything. Yeah, okay.
You start for only those 4 teams.
Okay. So you people don't want to participate? Okay. So the question, no? Yes? So shall we start? Okay, fine. So we'll start this round. So this round, let me give you a hint now. So this round will be a triad round. So you have to identify the triad, okay, as it comes. So very simple. Everything won't be like as per the triad, but the pictures there will give you a clue, okay? So we have fixed triad in our minds, so kindly don't try to change that, okay? So 30 seconds, okay? If you are pressing the buzzer, then no time. Immediately you have to answer. But direct question, you'll get some time. Yeah. So we'll start from Gulfstrand, okay? So first question for Gulfstrand. Identify the syndrome. Okay, hold on. So all these pictures give you a hint. No, sorry, wrong answer, but no negative marks.
Gone.
Cocaine syndrome? Cocaine syndrome?
No.
Are you high? Why are you saying cocaine?
So they get minus.
This is Cohen-Sayre syndrome.
So there are no second chances.
Jules Gonin is -1. Yeah.
Can you tell the answer once again?
Cohen-Sayre syndrome. So the next question is for payment. So look at the symptoms. Okay,
Chandler
Chandler has
presses
pressed
the
the buzzer. Look at the signs and symptoms.
24 seconds more.
Do they remind you of a triad? And if so, which condition?
Congenital glaucoma.
Excellent. So what is the first sign?
So that is megalocornea or ophthalmos. Third is photophobia. Fourth is blepharo.
You
So-
Second one
disappointed
is-
an oculoplastic.
It's not the triad,
sorry.
it's epiphora.
Epiphora. Yeah, epiphora.
Okay. Blepharospasm. Yeah, photophobia. So coming to the third question, Chandler. So which triad and which condition? This is a triad of symptoms. Which condition?
Pharyngoconjunctival fever.
Oh, excellent, excellent. Very good. So next question.
Plus 5.
Yeah, +5 for Chandler. So next question for Ridley. Identify the syndrome. Okay, Chandler has pressed the buzzer. Ridley. It's quite easy. Look at the pictures. Individually try to see the signs and then you'll get the syndrome. It's pretty easy. You give it in MCQs also.
VKH.
Okay, Chandler?
Reader syndrome.
Oh, excellent. Yeah. So do you get it? So who answered this question? Chandler, what are the 3 signs that you see here? Uveitis, yes. Okay, so who's the next team? Okay. So next question, direct question for Jules gone in. Is the audience enjoying the questions? Okay. So Jules gone in, direct question for you all. Name this syndrome or sign or whatever the triad. There's a hint there. So Duke Elder has pressed the buzzer. Jules gone in, it's your direct question.
16 seconds.
There are just 3 signs and you get it.
Excellent.
Excellent. Yes. Okay.
Yeah.
The other name for UGH?
You don't get a bonus point though.
But you can get a chocolate. Anybody from the audience? Another name for UGH syndrome?
Starts with E.
Doesn't end with E. Yes? Huh? No chocolates for Dr. Vivek, sorry. So the next direct question for Duke Elder. +5 for Jules Conn. So next direct question for Duke Elder. Ready? No, this guy is always not ready. I don't know what to do with him. Are you ready? Okay. Very easy. The easiest question of
Got
the
the
lot.
easiest.
No buzzers for this. See the symptoms individually. Yes. Jules Gonin has pressed the buzzer.
Congenital honor syndrome.
Yes. Okay.
They have not answered.
Oh. Who answered?
The question was for Duke Elder.
So that's the default.
This
You want?
question is cancelled. We cancel this question.
Okay.
We throw another question.
You have to wait. Okay, when we will come to you. So this question is cancelled. It was Horner syndrome, but it's cancelled. So next direct question for Duke Elder. And you cannot press the buzzer. Just joking, you can press the buzzer. So name this condition. Chandler has pressed the buzzer. Okay. Anyone anyone from the audience has got it can raise a hand.
Congenital rubella.
Okay, someone has raised.
Congenital
very
rubella.
good. Congenital rubella retinopathy. Very good. Excellent. So shall we go for the next question?
McKimmer.
McKimmer. Next direct question for you. Identify the cricketer, then you get it. Okay, Gulstrand has pressed the buzzer. There's a big hint.
You've seen him recently, no? Somewhere.
And he was very sad, almost crying. He was on the losing team. Audience, anyone got it?
Yeah, Gulstrand. Huh?
Miller? You only got Miller right.
Millard Google.
What do we do?
Okay, we give him. Give it.
Okay, we'll give +3.
What is the triad there?
Yeah,
Oh,
you'll
yeah,
have
you
to answer this.
this. Not David Miller. After him.
Ophthalmoplegia,
Areflexia and what is the green guy doing? Yeah.
ataxia. What is it? What is Miller-Fisher syndrome?
It's a variant of GBS syndrome.
Super. One chocolate for him, please.
We are giving, don't worry.
Given you the points.
Okay. So triad round is over, right? Everyone got a direct question. So triad round is over. Now gear up for the last round. So now you can be happy or sad or whatever. The end is coming. Okay? But it's never the end. Okay? So ready for the last round? So round.
Why is there so much silence? This is hyperglycemic state.
So I think they wanted the audience questions and not these questions. That's why they're sad. So we'll give you some audience questions also for the teams, okay? So coming to round 2. So these are also MCQs. There is something about the round which you'll know at the end of the round. So you'll have to go through the round to know about it. Okay? So that there is a clue in that. So if anyone figures out, it's your gain. If you have not figured
I think
out,
the audience should figure it out.
so this is a theme-based round. So the first was triad. This is also something, but you have to figure it out by the end of the round. Then you'll probably get it. So we'll start from McKimmer. Okay? Direct question for McKimmer. A 12-year-old boy receiving long-term treatment for vulnar VKC developed defective vision in both eyes. Most likely cause is...
Posterior subcaps.
Okay, very good.
Okay, fine.
Fine.
Good. No claps from the audience. खत्म हो रहा है भाई.
Second question for Duke Elder. The commonest cause for hypopyon corneal ulcer is Gulstrand has pressed, but it's your direct question. Moraxilla, gonococcus, pneumococcus or staphylococcus? Very easy. The audience are like, what is... What? 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 Yes. Yes. Come on, this is like...
Gulstrand gets +3.
This is like pre-ophthal question. Okay. So yeah, correct answer is pneumococcus. Question number 3 for Jules Gonin. Topical atropine is contraindicated in... Who pressed?
Payment.
Okay. Retinoscopy in children, iridocyclitis, corneal ulcer, primary angle closure glaucoma.
Correct.
Very good. So simple questions. So next
This
our
round
team
is easy, no?
Ridley. Which of the following is a technique used in pterygium surgery? Okay, very good.
Perfect.
Perfect answer. So what is perfect? wait. What is this? So if you get this, then +1 for you. Ridley. Cornea consultant is like no +1. Anyways, they don't know. Any pterygium surgery, there will be pterygium excision, so no points for that.
Give the opportunity to others.
Yes, anybody? Yes. Yeah, very good. Yeah.
Chocolate for him.
So the next question, direct question is for Chandler. Treatment of choice for ocular syphilis is amikacin, penicillin, gentamicin, erythromycin.
Jules has pressed the buzzer.
Direct question is Chandler.
Direct question to them.
It can't get simpler than this.
Penicillin option.
Correct. +5.
The next question for payment. Mydriasis is present in all except third nerve
Machimer has
lesions,
pressed.
pontine hemorrhage, datura poisoning, fourth stage of anesthesia.
Option 2, pontine hemorrhage.
Correct.
Excellent. Have you
He's
figured
not
out the
letting
round?
you down. Right, the last question
of this quiz is for Team Gulstrand. Most common cause of delayed onset end of post cataract surgery is. Do you even need the options? Pseudomonas aeruginosa, Propionibacterium acnes, Moraxella, or Haemophilus?
14 seconds.
Yes.
Tell in the mic. Correct.
Propionibacterium.
Okay, so audience, what was the theme according to you?
But anything else? So what is the theme of our Boss Summit? There are posters here. So which letter does it start with? So all the answers were P questions, so we could not reveal it. So whichever had P was the answer. It was so easy.
Your p-value is less than 0.005. Your p-value is insignificant.
So can we have some audience questions, sir? Audience, you all want entertainment or off-tal? Okay.
One of each.
Okay, so next question I can't ask because you know the B answer. So please wait.
Don't pee.
So which is the correct answer here? Yes. Which is the correct answer here? Ha, see, gotcha.
None of the above.
Yes. So audience question, they are all non-off-tal questions. So you have to raise your hands and they will give you the mic, then answer. If you answer in chorus, no chocolates, okay? Are you ready? Yes? Please answer, you raise your hand. Flying Horse, Jubilee and Taj Mahal are all Bangalore brands which are not available here but are available in US or UK. What are these? Very serious question. Yes, do. Sorry.
Not.
Tea. That was my guess as well, so we are thought sisters. But that's not the correct
Who is that
answer.
smoker here? Are you a smoker?
Anybody? Yes, sir.
Cigarette brands.
Sorry, sir.
ಅವ್ರು ಕೊಟ್ಟಿ ಚಾಕ್ಲೇಟ್ ಇಸ್ಕೊಳ್ಳಿ ಮತ್ತೆ ವಾಪಸ್.
Anybody? Anybody?
ಸರ್ ಅದು ದೊಡ್ಡ ಮಗ್ಗಲ್ಲಿ ಬರುತ್ತೆ ಸರ್.
It's entertainment. Yes, ma'am. Oh my God. Please, we had a clap.
ದೊಡ್ಡ ಮಗ್ ಅಂದಿದ ತಕ್ಷಣ ಬಿಯರ್ 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 ಆಲ್ ಟಿಪ್ಸಿ ಪೀಪಲ್.
Yes, the correct answer is beer, not bear. Beer. Okay. So the next question for audience. French educator, inventor of brain. How did he become blind? Yes, please, one hand I can see. Swati.
sympathetic ophthalmologist.
Obviously, it is a trauma. It's okay. Yeah,
Very good, excellent.
Oh, one day, full or economy or.
So does the audience want more questions?
See, she had asked you 2 questions, man. How was the first eye and then the second eye? You should have said trauma and then sympathetic ophthalmia. Sympathetic ophthalmia, ನಿಮ್ಗೆ ಗೊತ್ತಲ್ಲ ನೀವು ಡೆಡ್ಯೂಸ್ ಮಾಡ್ಕೊಳ್ಳಿ. Economist come. Are you into stocks and trades and all that? No.
One more question. Yeah, no, this guy, I don't know. Enough. No more
ಕೈ
chocolate.
ಬೇರೆ ಮುರಿದಿದೆ ಅವ್ರಿಗೆ ಅಂದ್ರೂ ಕೈ ಎತ್ತುತ್ತಾನೆ.
Anybody else? Take a guess.
ಪಕ್ಕದವ್ನು ಹೇಳ್ಕೊಡ್ತಾ ಇದ್ದಾನೆ.
No, look at that. Okay, I'll give you a
ಏಯ್
three
ರೆಟಿನಾ
options.
ಸ್ಪೆಷಲಿಸ್ಟ್ ಸಣ್ಣ ಸಣ್ಣದೆಲ್ಲ ಕಾಣುತ್ತೆ ನನಗೆ.
So, Chandrasekhar, don't open your mouth now, please. So, 3 options, then you'll raise your hands, okay? 20 kilometers, 60 kilometers, 90 kilometers. No. Yes, doctor? Yes, correct answer. 60 kilometers. Can we have one more chocolate for Dr. Sudhita? Yes. So it's 60 kilometers. Don't ask me who measured it and all, but it's 60 kilometers, okay? So, one more question for the audience. Which city has the most number of commercial airports? Which city? So we are calculating the marks of the quiz. So you still have options to get chocolates. So which city has the most number of commercial airports? Wrong answer. Good.
No answer.
We have famous soccer players from that place. Anybody? Yeah, you can think more on those lines. Pardon? No. Nobody's raising their hand, so correct answer is France. Okay, whatever.
Anyway, we don't know, so we won't give it.
Yeah. As if you have named a city, huh? So last question, Bangalore related. Please have a look. It's a very good question. So in 1943, 2 brothers, Mr. Venkatramana Ural and Mr. Parmeshwara Ural, came to Bangalore from Saligrama and opened a canteen for the students of Acharya Pathshala and National College. Yes, ma'am. Excellent. Please clap for them.
After Dr. Gauri Murthy has spoken, you don't have any right to speak. Are you crazy? Now she gets a dosa also. And she will all host us as well. You will have no sheet.
So,
have you had dosa? The multiple floored dosa at Vidyarthi Bhavan, have you gone there? You should. ಎಲ್ಲ ಅಲ್ಲಿ ಡಾಮಿನೋಸ್ ಅಲ್ಲಿ ಪಿಜ್ಜಾ ಗಿಜ್ಜಾ ತಿಂತಿರ್ತಾರೆ ಬಿಸ್ನೆಸ್ ಪೀಪಲ್ ಗೋ ಹ್ಯಾವ್ ದೋಸಾ ದೇರ್ ರವಾ ವಡಾ ದೋಸಾ ಕಾಫಿ ಸೂಪರ್ ಓಕೆ
so we come to the end of the audience quiz as well. So hope the audience has enjoyed, and we'll shortly reveal the results of the quiz. Our quiz masters are in deep conversation. So
whatever questions we have we can keep asking.
okay. His Highness people are having a really hard time. They don't have chocolates.
Chocolates illa beda pavai.
So participants, we all have a pen for yours. So don't steal other people's pens when it's with us.
Until you get the marks there no
Okay,
no.
just some clarification. The answer of Serena Williams and Venus Williams will not be taken. Let's play by the rules. The answer of Millard Gubler and Miller Fisher will not be taken. And cocaine and cancer are totally different. So these three things we have cancelled and put points accordingly. Although after making the changes, whatever scores were there earlier and whoever stood first, second, third remains the same. So for sake of being clear.
Yeah, it didn't change. So are we done with the
Yeah,
marks?
we are done with the scoring.
So just for the heck of it, because I displayed it and because this question was also typed by me, identify the false statement
There
about
is- there is a-
suprachoroidal space injections. That identify the false statement. The
Hold,
drugs
hold, hold.
injected in the suprachoroidal space were undetectable in aqueous humor and
Fine.
plasma. Better bioavailability to posterior segment. Micro-injector systems enables quick and safe administration. Steroids, anti-VEGF agents have been tried. Correct statement. Identify the false statement. Identify the false statement. Yeah, A is the right answer. You get actually significant amounts. In fact, one of the drugs was discontinued because the patient developed severe glaucoma and all that. One of the drugs, inserts. So now, actually, interestingly, we have a tie.
Yeah,
between
there's a
two
tie
teams.
between Jules Gonin and Duke Elder.
For
the
one
tie-
of the places, we don't know which place. Hey, Bhagwan, utha lo is ladki ko.
Okay, so the tiebreaker will be also buzzer.
So the next question will be a tiebreaker question. Only one question. Whosoever will answer.
Whoever presses and count that person. When it buzzes, don't keep your hand. Press the
Nobody else attempts. Yeah, negative marking is also there. Yeah, -1, negative marking.
If you press only when you're sure of the answer.
Are you ready with the buzzer? Shall we go to the question? Jules Gonin and Duke Elder. Okay. Which of the following statements about vitreous hemorrhage in PDR patients undergoing hemodialysis is more true? The incidence is higher in hemodialysis when compared to peritoneal dialysis. Need for vitrectomy is more as absorption is less or unlikely. Incidence is lower in the first year when compared to the pre-dialysis year. And heparin-free dialysis can be tried for a long time. Duke Elder, you have to give the answer in 5 seconds. 5, 4.
Option D.
Sorry?
Option D.
D. D as in Delhi. That's the wrong answer.
That's wrong.
So you still have a chance.
No, anyway, they got the minus.
They got minus, so the tie is broken.
See, listen to the question properly. Vitreous hemorrhage in PDR patients undergoing hemodialysis. Okay. Incidence is higher in hemodialysis when compared to peritoneal dialysis. There is no difference between peritoneal and hemodialysis. Need for vitrectomy is more as absorption is less likely? No. There is no proven, in terms of long, there have been studies where they have done evaluated patients on dialysis for 5 years, and they found out that the incidence of hemorrhage is not more when compared to dialyzed patients. Incidence after starting the dialysis in the first year is lesser when compared to the pre-dialysis. So the C is the right answer. Okay? And heparin-free dialysis cannot be tried for a long time. It is always a stopgap measure. Got it? That's where you are wrong. All right? So, shall we? Okay, so I hope the quiz was interesting enough. See, my personal belief has always been that the person who has scored the maximum has actually learned the least. So there will be one team which will be the loser, but then someone has to be the winner, so that will be the winner. So it's like the contradiction.
So here there are many losers.
There are many winners, one loser. Sorry. So the third place goes to Jules Gonin. Any guesses for the second place? Any guesses for the second place? The second place will be in the first place, Gulfstrand. The first team.
Gulfstrand, you stand
He's
second.
surprised.
Second.
Me? Second? My God, he's so surprised.
Come, we'll put a crown for you. You can give us a walk also.
Then you can do that. And the first place goes to?
Payment.
Wow, mere sher. Payment gets the first place. So well played, all of you.
You all can tell your names.
And your colleges as well.
And no, colleges should not be disclosed.
Okay. Girls' strand, starting from girls' strand.
Dr. Sajal.
All of us are doctors, man.
Anu Talit.
Simran Hunlani.
Preksha.
Shubham. Raj Hirani.
राजू नहीं है.
ऐसे मूवी का नाम
मूवी का डायरेक्टर है वो.
राजकुमार हिरानी.
राजू हिरानी. हाँ. चैंडलर.
Supriya.
Shivani.
ನಿಮ್ಮ ಹತ್ರನೇ ಇದೆ ಮೈಕ್.
Tanvi. Darshana.
Pradnya.
Did you just rhyme? What are the names? Say the names
Ashra
again.
and Sahasra.
Nashra Jasra.
Sahasra.
Jasra. Shh. You're not supposed to.
Sanjana.
You have to change your name. To rhyme with them. Yeah.
Yes.
Darren.
You can also rhyme with them. We'll call you Asura. Okay?
Do you agree with her? Anyone agrees with her? You will.
Yes.
Rishabh.
Reshma.
Anagha. Aishwarya. Priyanka.
Okay, can we get the prizes, please? The prizes are also sponsored by His Highness. Sandhya ma'am.
Can I
and
request
Bindu.
Dr. Gauri Murthy to be on stage, please? To do the honors along with
Yes.
Dr. Sandhya as well, our secretary.
But ma'am, the glaucoma answer was like cherry on the top.
Ma'am, you can come on stage, please. Thank you.
The members of team Jules gone in,
So we have
the third prize.
we have two glaucoma specialists on stage, Dr. Gauri Murthy and Dr. Sandhya.
Tell me something about Jules gone in. Igni puncture, good. Yes. Come. Third prize.
Yes, okay, ready? Yes. Ready? Plus, smile. Thank you.
All the best for the next round.
Team Gulstrand in the second place. Tell something about Gulstrand. Good.
Don't lose hope, man. You were like literally giving up when he was giving all that Venus Williams marks.
Now let's welcome the winner. Anyone for background music? Sir, you can give some music. Come.
Your favorite.
Team Payment, please, on the stage.
Yes, you should. He's not let you down. Not letting down Dr. Vivek.
Yeah.
I think he's doing something. Raju.
Ready, sir? Ready?
Dr. Dhwani, please. Yes, please. Alicia, you can stand and click a photo for us, okay?
Okay, ready? Ma'am, ready? Look. Plus, smile. Thank you.
Thank you all. Thank you, audience. Thanks to the entire team. And there are some gifts for all the participants. So please wait. Audience, please stay back for the Insta Reel round, which is coming up next. It's going to be quite interesting. You won't get any chocolates for staying back. Payment team is already dividing the.
कौन क्या लेगा? हाँ, वो सब कुछ एक ही है. But capacity तो एक ही है. ये chocolate इट्कोंडिद्या?
Yeah. I thank our BOS organizers for having given us another opportunity at this, and also HIS people. Thank you. Our sponsors for the session.
Can we clap for them, please?
HIS. They've got really good quality products. I prescribe and I endorse them as well. HIS, His Highness. Thank you so much. Thank you.
मैंने जैसे रॉबिन का नाम पढ़ा मैंने क्वेश्चन नहीं रॉबिन को ये किसी को पता है अभी ये हो गया अभी मैंने रिवाइज करके रहा डांस एक बार
All the teams, please stay around for the Instaboss contest.
There are two more rounds. One main round and talent show. Quiz is done. Quiz is done.
This is a triathlon comprises of 3 rounds. One quiz, one Insta reel and one talent show.
Now the reel.
Now the reel Insta reel. We have submitted one reel.
I'll forward it to you.
And then
Talent show is in Hall A, the main hall, at 5:30. 5:30.
We request all of you to stay back for the boss Instaboss contest.
And triathlon teams, in case you have revealed your team name, you will lose marks. So if you want to make something and submit it in the last minute, I think you have that option, but it's all up to you. But please don't delay the whole event.
It's already ready, right? Who are the other judges? If you have the number, I can call out. With two other people, ma'am. I think one is Kailash. Yeah, Kailash is here somewhere. Yeah. He's like, I don't know what rules are this. He's like there. Who? Kailash. Hello? Okay. Skip, I believe. I'll record it, ma'am. I'll be there only. Nowhere to go. No, ma'am. I can't go until the PG. All the PG things are over, ma'am. All the PG things are over. No, but if you want, you can take our thing. That's why I asked Reena. It must be with this only, ma'am. Otherwise, what else it is?
What's the score, ma'am?
Ma'am, that's what, ma'am.
Payment
So,
is the first one, right? Payment?
ma'am, I've written. Ma'am, first was payment, second was gold span, third was rules for this. You killed her, the most. And you killed her, and this came like they were the same.
You need the score.
They got -1.
You need score. We can start the Insta, no?
Yeah, yeah, ma'am. Ma'am, I'm ready. I'm just
Mic,
waiting for
this mic, no? Just ask.
Siri.
Hello, everybody. Requesting all the teams to gather for the Insta reel, please. You can sit. For the Insta reel, all teams, please gather. Request all your friends also to come. Put it in. Yeah, yeah. No, photo. Take
Yeah,
a
you
photo.
can take a photo.
Keep it fair. Take photo.
This Insta reel thing,
Yeah.
thing will go last.
Why? No problem. Yeah, we'll tell them. Chandler will do the Insta last. They are rolling up.
Huh?
Chandler wants to do last.
Wants to do last?
Because they are.
Okay. Done. Done.
Okay, ready? One step forward. Once again, ready? Camera? Yes. Ready, ready, smile. Jorag laugh. Yes, once again, once again.
you. Tanishte Bharata. How will it come? Good afternoon, everyone. So after that very exciting quiz, quite a nail-biting finish with everyone, I think, missing the first and the second, very narrow margin. So I'm thinking that all of you really are still in the game. Because, when you look at the marks, I think all of you are very much in the game. So let's put your best foot forward and move on with the second part of the triathlon. So that's the Instaboss, right? So first I'd like to welcome the judges. Dr. Rammurthy, Dr. Kailash, and Dr. Amulya Das. Please give them a round of applause for taking their time out on a weekend, to come here and judge your Instaboss. Yes, so. Yeah, ma'am. I'll start it after you tell me to start.
Okay, welcome everyone to a very unique session that is being done for the first time at Boss. So this is the Insta Reel competition, and as we know that Insta Reels are the things that are so in, and this is the best way to reach people now. So we have created this triathlon in which Insta Reel is one of the very important things where we are giving almost equal marking to the abilities of our students to connect via Instagram with the patients. So the criteria that we will be, judging upon is relevance to the topic that has been given to you almost 2 weeks back, the educational value, the creativity and innovation, the engagement and impact, clarity and presentation, and technical quality. So overall, you'll be looking at 100 marks, and the judges will also be asking you, the teams, the questions like who was involved in making the production, what was the thought process that went into making your production. So I hope all of you are up for it and all of you are here. Yeah, all the best. And as the Zoom meeting that happened, we had a Zoom meeting with all the participants, and it was very clearly conveyed to the participants that they are not supposed to reveal which is the participating hospital or the institution, so that there's no bias. So we are working on a very, so even the topics were given in a double-blinded manner. So even ma'am didn't know what were the teams, what were the topics. We just allotted numbers, then they were given to a third party. The third party matched the numbers, then ma'am gave me the numbers, and I also didn't know. So double blinding. So this is the level to which we have gone to ensure that there is equality.
Same time, give me the 7 sheets so that they can pick up and come in that order. Yeah, randomly. 7 sheets. Yeah, Allah. 7 sheets could be. Your team first, your second agar. Eh, matal bayas. But. Sorry. Okay. Where is the playing? Like, the team will come then. Let the team come now. Or whoever is there. Okay.
So I'll start
Okay.
with Sir's going to say who's playing.
Yes, sir, please.
Jules Grant.
Relax. There's one more. Five now.
5 are there, sir, but he's just stuck in some work. That's it.
A very good evening, every.
What do you need, ma'am? What do you need? Sir, we have 7 teams totally. You can keep it, sir. First. First one is relevance. Yes. This is good. Okay, meanwhile, we get the, hiccups and glitches a little settled. How was your feedback about your quiz? You liked it? It was nice? Okay, good. What is there to like, is it? Oh, that's it. So this is the Jules Gonin team, and their topic is patient education video on examination in the elderly. And we'll play the video now. Can we start, sir?
No, 1 second.
Jules Gonin.
Yes, sir. A very good evening, everyone. We are the team Jules Gonin, and the topic given to us was patient education about eye examination in the elderly. Here is our reel.
It is said that to care for an elderly and an infant is the same. Do you also have aged parents or grandparents at home who held your hands during your first steps? Now it's your turn to care for them and to hold their hands at this age. Let us now see how we can do it through an ophthalmologist's spectacle.
Myopia is a physiological eye condition which appears around the age of 40, in which the ciliary muscle inside the eye weakens with age and the natural lens inside your eyes thickens or hardens, which causes near vision to become blurry.
Glaucoma is a leading cause of blindness in elderly. It is characterized by 3 findings: visual field loss, optic nerve damage, raised intraocular pressure. The early stages, patient is very asymptomatic. As it progresses, the peripheral vision is constricted, and in advanced cases, it causes tunnel vision.
India is the diabetic capital of world. It can affect the nerve layer of the eye, which is known as retina, and it can cause so many complications like macular edema, which is in the central part of the eyes, and also it can cause traction and lead into retinal detachment. And also, some bleeding can happen inside the eyes, which is known as vitreous hemorrhage. If you are recently diagnosed diabetic and have not visited an ophthalmologist, bega hogi toskoli.
AMD, also known as age-related macular degeneration, is known to affect the macula, which is the central part of the eye. Some of the symptoms it can cause are distortion in seeing objects, also known as metamorphopsia, seeing wavy lines, significant central visual loss, and bleeding into the eye due to formation of new blood vessels. Hence, regular eye exams are essential for its early detection and management.
Please, 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 don't prove I'm right.
ನಿನ್ನ ಕಂಗಳ ಬಿಸಿಯ ಹನಿಗಳು ನೂರು ಕಥೆಯ ಹೇಳಿವೆ ನಿನ್ನ ಪ್ರೇಮದ ನುಡಿಯ ಕೇಳಿ ನೂರು ನೆನಪು ಮೂಡಿವೆ.
To gain more insight about your eyesight, follow our page
Jules Golden.
Anything to say in making of the video or presentation or getting ready for the video or the concept or photography, shooting or anything? If you want any, if you have any declaration, you can openly declare.
The fact that we do not have any financial interests in this. Secondly, it is a patient education video, so our aim was to make it in a easy language and also very catchy, so that people who are seeing will understand, and they might just see the whole thing rather than just stopping if it's too boring or plain at one point. Sorry, sir.
The others would like to add.
So the whole team sat together. We first thought about what a person would be expecting to know about, why an elderly needs a regular eye examination. So our aim was to make sure that they know that there are so many things that can happen. And one very important thing we wanted to highlight was that people should not delay their eye examinations thinking that it's such a hassle to come to a hospital, to an eye hospital or a general hospital. And they should come frequently because we are there, we are accessible, and regular eye checkups are of utmost importance because most of the times these conditions are silent. And it might not come into notice unless it has progressed to a very advanced stage. So to prevent that,
Why do you feel that your video is unique and you should win the prize? What is the uniqueness of your video or the take-home message in your video to the community or to the society? Or why do you feel your video has to have the priority on all other videos?
Within the given time limit that we were given, we have tried to include as much information as we could do in a possibly interesting manner. And we would not say, we feel that we have done well, but of course there are other teams also. And what the best part is that we as a team really enjoyed doing it. And the fact that we're trying to reach the community, that is more important to us.
You said no financial interests. Did you all spend money on making any of this?
We've done everything single
yourselves?
editing, shooting, compiling the video, everything is just us.
Did you all use any AI tools?
Nothing at all.
Okay, who was the creative head? And since it's a team effort, one would have thought of the idea, the other will implement it. There will be one person who will be doing the groundwork behind the scenes.
Okay, so five of us sat down.
Okay. Yeah. You can introduce yourself, Doctor.
I'm Sakara. About the concept, it is like a teamwork only, ma'am. It is not from one person's side. It is like we were discussing at that time, one person will be telling some comments and other person, and we were improvising ourselves. And about the editing works, these two people did their full effort.
Exactly.
Last 2 days, they were fully
So what did
behind
you use, Doctor? Which software did you use to edit your reels?
Can I answer? Yeah. So the main software that I've used to edit my reels is iMovies. That is my main thing. We've shot many of these videos on our phones, maximum of these. The other parts I have made on Keynotes, and I've edited and I've incorporated them together, and that's how we've done. that thing.
Okay, thank you. Very interesting concept. I don't want.
Sure.
Yeah.
The content. Thank you. All the best.
Thank you so much.
Thank you so much. That was an awesome reel with all the current trending music that they have added to it. Sir, which team do I call out next, sir?
I will tell you.
Yes.
Let them relax.
No, they didn't. They wrote it. So don't we have any postgraduates, who are rooting for their teams? We don't know who they are, but you know who they are. So are you guys rooting for your teams? Is there no one? Yes. You should be so loud that we come to know which team is yours. Okay, so next we call Team Duke Elder. So the topic that was given to them was patient education video on squinting children. Yeah, can we have the lights, please? Yes.
Hi everyone. So our topic for today was patient education on children's squint. So this is the video.
Off the lights, please.
You need to introduce yourself.
Oh, okay, fine. So I'm Reshma.
I'm Dimple.
Dina.
Vishal. Darren. Sorry? Darren. Vishal. All DDs, sir.
Yeah.
and it's the team is Duke Elder team.
Duke Elder. Okay.
Yeah, you can play your reel. You need to,
Have you all visited the Squint clinic?
Oh, yes, ma'am, we have.
Like, all of you? Lights,
Oh,
please.
yes, ma'am.
Okay. The video has been done beautifully, no doubt. The clarity and the technicality involved is crisp. And the idea with which you started out is beautiful. But since I handle Squint Clinic at a government setup at peak hours, the ground reality is very different from what you've presented. The use of music, the background, it's very pleasant. It's engaging also. You want to see what's going to happen next. So thought process and engaging process is very good. But I just thought I'll just highlight how it actually happens. Because the child, at least from a rural background, somebody in Raichur, is ignored. They feel it is a boon. Okay, and the parents don't bring them, the grandmother will bring them. Okay, he will come at the crisp age of 6 and 7. Okay, the squint itself is a stigma for them. They're like, can you fix it? Can you fix it? I cannot fix it before getting a BCVA. Okay, to get the BCVA, I have to treat them with glasses. And again, compliance is an issue. Illik barlildru al toruskoli. Al toruskoli first. And just another little thing, examination of children is also very hard. Attention span is so less. Worst is I'll be wearing my white coat because I'll have to go to other OPDs, I'll have to go to the office to sign something. That itself will scare them. You know? So the reel is beautiful, but since you're going to have an exam, since you're still going to pass out, I just thought I'll highlight this. You didn't need to bring in a lot of creativity to just cash in on those few moments, you know, CSM method. Is it a Hirschberg reflex? I just use my finger. I just use my finger before they start crying. Okay, and I'll have a resident who will be saying, ma'am, our patient can ಮಾಡಬೇಕು, ಈ patient can ಮಾಡಬೇಕು. So when you're working under pressure, it's a beautifully done reel. But just to put in a bit of reality, there are several factors at play in the community. Okay. As a child, the squint is a boon and a stigma. And they'll get, I have seen mothers crying when we give amblyopia treatment. What has happened to my child? When you patch and we give colors, don't make them do homework. The child hates it and you're giving homework, means again stress adds. क्या हो गया है मेरे बच्चे को? आप ठीक हो गया या नहीं? And AHP is another thing. Abnormal head posture. Nystagmus, you have Kestenbaum procedure, but that AHP, these beauty conscious mothers, you know, they'll come and they're like, usko theek kar do. And little that side, this side also, they're not happy. So parents also have to deal and the kid also have to deal. So beautifully done reel, but just to put in a bit of reality, I just thought.
Ma'am, so the thing is, we have seen like a lot of this reality where patients are not compliant, the children are, I mean, we showed it as if the child was the most cooperative child, but we know it's the exact opposite. At the same time, the reel was for a patient information, so then like, or to encourage them to come to us, so we wouldn't want to tell them it's a difficult procedure. That is the idea behind it. Otherwise, we definitely know it's a very difficult process because we see kids day in and day out. That's allowed as OPD all the time.
Yeah, exactly. The most cooperative and most easy patient probably is what you portrayed, where in reality it's the exact opposite.
Yeah, so we want to lure patients in and make sure they stay. So that's why.
It's
otherwise
put up in a really good way, which will bring attention to the matter, and which will also allow people to learn about squint. That's good.
Yeah.
Any declarations? Any declarations on AI or other platform usage, apps, and other things to create the video, make the video?
No, like ma'am, you pointed out the pleasant music. Like we just wanted to make sure, like since a children's video, we wanted to be a even toned music, and it's not distracting in any way. And otherwise, we have not used any like. That was it's a no what is it? Copyright free music. So we made sure it's copyright free.
Have you declared that?
Sorry, it's copyright free music, and we compiled the video together.
How do you feel for the previous video and this video? Which should be in the thing now?
Ours, obviously.
On what grounds?
Oh, I think so. You can decide that. It's fine.
Okay.
Woohoo! You can. That's to crisp editing. Oh, claps, please. They have done an awesome job. Okay, now I welcome Team Gulstrand. Please come up here and own up your video. Claps, please. So the real topic that was given to them was a very current topic, a patient education video on diabetic retinopathy. Am I right? Yes. So why don't you guys introduce yourself and, open up your...
So, good afternoon, everyone. This is Team Gulstrand. This is Dr.
I'm Dr. Adira Nair.
I'm Dr. Sajil.
I'm Dr. Anu. And I'm Neha. And
Hey.
we have Simran.
We have
Yes.
Simran also, but she has gone.
Another.
So, here is it.
Okay, so can we start? Yes.
Hey, what are you doing? Just pumping nutrients. Huh? But it's a lot of sugar. I might die. Hey, are you seeing this? What is it? Have you checked your sugars recently? Yes, I recently checked my sugars and it's completely fine. Completely fine, you foods. Okay, what do you want? It's diabetic retinopathy. Hey. Hey, are you seeing this? There are red spots all over me. There's nothing. Changing. There's nothing. You're not able to see it. No, of course, you won't be able to see it. You're not an expert. That's what ophthalmologists are for. Just take me to an eye doctor, please. Chill, don't worry about it. Everything is fine. I'm dying. You're going to go blind. Please understand that. No. What are you doing here? Hey, get off my way. Just get out of here. Oh, what is happening? Help! Help me! Help! 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 Help!
Hey, you are here.
Who are you?
I am the peeing machine.
Peeing machine. Oh, the kidneys.
Yeah, why are you here, bro?
It's a long story, bro.
Tell me, I have a lot of time.
Basically, she killed me. I had already warned her about diabetic retinopathy.
What is diabetic retinopathy?
You don't know what is diabetic retinopathy?
No.
It's a disease which affects the blood vessels, which can cause it to leak, swell, or even close it off, which can prevent me, that is the retina of the eye, to function properly.
That sounds so serious, man.
Of course it is serious. In the initial stages, it can be asymptomatic. That's why routine eye examinations are a must.
Can it make a person go blind as well?
Of course it can make a person blind. In the initial stage, it starts with blurring or floaters or haziness of the vision, but then eventually it can even lead to retinal detachment, which can make the person blind.
Why? I'm telling you, prevention is the best cure.
Yeah, exactly.
और ऑप्टिक नर्व कैसे? Art is also here.
Yes, any declarations?
So, see, I'll tell you the perspectives behind making this reel. So, there were two perspectives. The first was education, the second was engagement. So, the first thing is that this reel is not primarily for ophthalmologists. We all know what we are talking about. Okay, all of the ophthalmologists know about diabetic retinopathy. So, our perspective was to educate the patient. And the serious reality here is that people do not know that diabetes even affects the eyes. When I told my dad about it, he told that I don't know if diabetes affects the eyes as well. So that is why we wanted our message to be in a very simple language. The second thing is that in Insta Reel, the most important thing is when you are scrolling, that 1 second is what catches your attention. Otherwise, if I start talking, like I start educating or start talking normally, it will never catch your attention. So that is why we had shown the perspective of the eye, how a diabetic eye would feel. And that is why we have added that comic elements. Otherwise, no one would see us. So the third thing is that we wanted to make sure that with adding these comic elements, we do not lose the seriousness of the reel. That is why that music, and we have shown the complications, and at last we added the message as well. So that is the perspective, and that was the motive behind our reel.
No declaration, sir. We shot it in an iPhone and we mixed it in the Canva app. The editing was done in the Canva app. We did it ourselves, all of us together. Yes, free edition. No, Usman. We shot it all separate. All the scenes were shot separately, and then we added it. We added the audios together, and the labels were also added by us, like in separate.
Copyright? Copyright?
No, idea was ours. We did the script. We started with a person talking, and then we thought it should be something different. So that we thought, why don't make our eyes talk, so that the eyes can tell about what is happening inside. Yeah.
What's the highlight of the video, from your side? What do you feel?
We think that it's quite engaging, and that it will reach the person, like the people who are seeing.
I think we'll highlight, if we put it on Insta, we'll get the most views. We're quite sure about that.
Who's the brainchild behind this?
No brainchild here. All of us are creative heads over.
We discussed over the idea, and then we prepared the script.
Yeah, very good point made, because I did some research when I got the mail that will you come as a judge. So when I did the research, they say that for this quarter, it is 5 seconds. You only have 5 seconds to capture the audience, and next he'll swipe. And like a point which you highlighted, it says that you know what you're doing. And the other feature that you also highlighted, when I looked up the criteria for judging a good reel, the catchy phrase was highlighted, as well as the tune. The song, it'll be some song which the public is very familiar, which is doing the rounds. Okay, so if you put that song in itself, he'll engage. Ye wahi gana tha na, the audience engages. Yeah, so that wow, kitna beautiful, that grammatically incorrect thing went on loop, na? Are you all familiar with that? So beautiful, so wow. Didn't that do the rounds? Quite a bit. Even in the newspapers, everybody was talking about it, and everybody was like, this is grammatically incorrect. It is irrelevant, as long as it's engaging. So in terms of the aspect that you all have gone into, you've personified it, and the dancing thing was beautiful, the hemorrhage. Patient really tells, at least for me, I mean, retina people are here, I'm scared to admit, but patient will say, "Kan munde kempu aadta ide, oradta ide." They'll say so.
So what our idea was, we'll like the dancing thing we'll portray as floaters. So, but then we thought that okay, the patient won't, the general public won't understand what a floater is. Maybe that is what we thought. That is why we added the term hemorrhage.
Okay, thank you, Team Gulfstrand. That's a reel I would share. A claps for them, please. Now, next, Team Payment.
Good afternoon, everyone. No, we are a team of 4. I think we should talk.
My name is Preksha.
I'm Dr. Raj. I'm Shubham.
I'm Dr. Alisha. So our topic was we had to create a patient educational video on consanguineous marriage-related eye disorders. So we tried our best to convey the message. Consanguineous marriage. It is union between two individuals who are related as second cousins or closer. It is a deeply rooted social trend. According to global consanguinity trends, population of North Africa, West Asia and South India, consanguineous marriages are culturally and socially favored. They constitute about 20 to 50% of all marriages, with first cousin union accounting for almost one third of marriages.
ಮೇಡಮ್ ಅದು ನನ್ನ ಮಗುವಿನ ಕಣ್ಣು ಹುಟ್ಟಿದಾಗಿಂದ ಬಲಗಡೆ ಕಣ್ಣು ಒಂಥರ ಬಿಳಿ ತರ ಕಾಣಿಸ್ತಾ ಇದೆ, ಏನ್ ತೊಂದರೆ ಇದೆ ಗೊತ್ತಿಲ್ಲ, ಅದಕ್ಕೆ ಒಂದು ಟೈಮ್ ತೋರ್ಸೋಣ ಅಂತ ನಿಮ್ಮ ಹತ್ರ ಕರ್ಕೊಂಡು ಬಂದಿದ್ದೀನಿ.
ನಿಮ್ದು ಸಂಬಂಧದಲ್ಲಿ ಮದುವೆ ಆಗಿದೆಯಾ?
ಹೌದು ಮ್ಯಾಮ್, ನಮ್ಮ ಮಾವನ ಜೊತೆನೆ ಮದುವೆ ಆಗಿದೆ ಚಿಕ್ಕವರಿದ್ದಾಗ.
ಒಂದು ಸತಿ ಚೆಕ್ ಮಾಡ್ತೀನಿ.
ಏನ್ ತೊಂದರೆ ಇಲ್ಲ ಅಲ್ವಾ ಮ್ಯಾಮ್?
ಒಂದು ಸತಿ ಚೆಕ್ ಮಾಡ್ತೀನಿ. ಹೇಳ್ದಾಗ primary healthcare providers are faced with these couples demanding answers to their questions on the anticipated risk to their offsprings. Preconception and premarital counseling on consanguinity should be done. Are you willing to risk the vision of our future? See your future clearly, because every child deserves clear vision.
Yes, same thing. Declarations, copyrights, if anything.
Yes, sir. Actually, we have used one video clip from True Hope Foundation, and we have already asked them if we can use their video, and we have already asked the organizers if we can use the video clip. That is our only thing. Otherwise, it is all created by us, and it was shot on iPhone, and editing was done on InShot app, not the premium version.
Images, all of them sourced from Google?
Yeah. All of them were from Google.
How serious you were when you were making this video?
So,
Since it's an educational video on Insta, even though it's a competition at BOS, the whole idea was to train you people to create such patient informative booklets, pamphlets, or videos, or AVs, whatever it is. Very short and sweet, so that the public can be educated in simple languages or visuals or whatever it is. So how serious you're really engaged in preparing this video or doing this video?
So basically we wanted to keep the reel short so that people don't just scroll it over, and next is we use the most scariest pictures as possible so that people could know about the seriousness about it. And also in rural populations still consanguineous marriages are taking place, especially in South India, as I've told in the reel. It comes in the global trend, so that is what the message we tried to convey, and we use the scary pictures to show that these are the situations, these are the problems that you can avoid if you can avoid consanguineous marriage.
Yours is the fourth video here, fourth Insta video here. Compared to other three, what are the pluses here and minuses here? In terms of the manufacturing or content or preparation or info or originality or educational content, whatever it is.
So we would agree that our editing was not the best here, and we have come up with the best in the limited amount of time that we were provided. And since this is a brainchild of all four of us, we are proud of it.
Thank you. All the best. Thank you very much.
Thank you so much, Team Payman, for that very educated video. Can we call up Team Ridley? Please, cheer them. Team Ridley is doing a patient education video on glaucoma.
Good evening. We are from Team Ridley. I'm Meghna.
I'm Tanvi.
And I'm Dr. Pranav.
There are two other members. They are practicing for the talent show.
Can we off the lights? You have to switch it off.
Have you experienced these symptoms before? Problems with your sight vision and in driving? Or are you struggling with severe headache, vomiting, pain in your eye, redness, and unable to look at the bright light? Then you're probably suffering from a condition called glaucoma. So, what is glaucoma? It is a disease where the fluid inside your eye builds up causing increased pressure within the eye and damages the nerve behind the eyeball. Risk factors could be age beyond 40 years, farsightedness and nearsightedness, injury to the eye, excessive steroid medications, family history of glaucoma, and conditions like cataract, diabetes, and hypertension. How do we manage glaucoma? We first check your eye pressures and subject you to eye scans. Once your doctor confirms it is glaucoma, we start with the treatment. Initially, we start on eye drops, which is to be used every day without fail at the fixed time told by your doctor. Needless to say, dedicated follow-ups is a must to keep the condition at check. When glaucoma is not controlled by medications, then you will require surgery. Glaucoma is a silent thief of sight. Even with the treatment, the vision might not go back to what it was before, but it will prevent further damage if you recognize the symptoms at the right time and get your eye examined regularly. Everybody is under a lot of pressure, but so is your eye. Please take care of it.
We have used a non-copyright music. We have used the software Adobe Premiere Pro to edit. So apart from a few Google images, all the animations were done by us, including the text and everything.
Yeah, very impressive, and you all have made it a point to put across the message that it will not vanish. It is a condition which they need to live with, but live better with your help. So editing was done by everybody?
Yes. It was done by all of us. It is all of us collaborated and we pitched in the ideas. So as we were shooting, we came up with new ideas. So we had to scrap the old ones, come up with a new idea, then change the entire script. So a lot of ins and outs were happening, but at the end we were happy with what we were able to
I'm
do.
glad you said that, because that really happens when you come up with some idea. It cannot be materialized. So good to know that you've pursued and persisted with your ideas. It's a very well done. Thank you.
Great work, Team Ridley. It's a lovely video, which is going
Whose
to be
voice was
edited.
that?
That was one of our friend Darshana. She's supposed to be here.
Male voice, right?
No, it's
female
female,
voice.
yeah.
Okay.
We have done a voiceover,
Ah.
so it's more clear and audible.
So we have recorded it using our phone, and we have done a little bit efforts on the editing systems to make it clear and remove the noise.
Yeah, some homework has been done that I could see. Okay, good. Thanks. Thank you.
Thank you.
Thank you, Team Ridley. Okay, now I call upon Team Makima. Yes. Their topic was patient education video on eye donation.
By the time they get ready, the other teams, as you all know, there's a talent show which will be starting at 5:30. So if the ones who've already finished the Insta reel and would want to go and get ready, you can go and get ready, or stay till the other two get so. That's your choice. But we'll be starting by around 5:45. We'll be starting the talent show. There are green rooms there behind the auditorium, so you can make use of it and check your audios and all that. Okay.
Yes. Can you introduce yourself?
I'm Aishwarya.
I'm Priyanka.
I'm Anagha.
Okay.
Hi sir, I'm Dr. Anagha. I'm just going to say that this patient is unfortunately not going to be able to make it for you. The only thing that we can do right now for this whole 20 rupees is to probably light up another person's life. We have a very nice corner donation program in our hospital, and he seems to be a perfect match for a 2-month-old baby that was born blind. If the family members are willing to donate the patient's corneas, probably we can bring light into the lives of a small culture, if it's possible.
ದೃಷ್ಟಿ ಹಂಚಿ ಭವಿಷ್ಯ ಬೆಳಗಿಸಿ.
Topic was eye donation alone or anything specific about it?
Educational video and eye donations.
You all put up your hospital name there, which is not supposed to be done.
I changed the video, I think it didn't get changed.
That was by accident, so technical error. We had submitted another video, I think.
I changed the
Very
video, but it
sorry
didn't
about
get
that.
changed.
Extremely sorry.
Yes. No other declarations, copyrights, that, this, everything, apps, all good.
We used InShot, sir, non-premium version.
How much of homework, editing, re-editing, efforts, concepts?
We had very short time.
We brainstormed the idea maybe like a few days back, sir, but putting it into action required coordinated effort and help from everyone, ideas from everyone in our department. They all lent us their helping hand, and so we were able to make a video. Hope it is very useful, especially in the rural parts of India, where eye donation is looked upon as a taboo. So hopefully it can spread a positive message to the rest of the country and rest of the world one day.
I feel the information is enough, or the display is enough for the public to get motivated?
Definitely, sir. I think we did incorporate some visuals into it, especially the mother holding the baby and the young girl trying to put on makeup, which are, I think, very sensitive. So hopefully, it at least it can reach the general public, the layman, and they get an idea about what exactly cornea donation is.
I'm not the judge, but I would still make a comment there. How is corneal or eye donation different from other organ donation? Because that was what was highlighted in your reel.
The beauty of cornea. Eye donation is still the most common donations in the world.
We are asking general questions, but he wants some technical answers now. Medical, technical, yeah.
7.8 million are getting cornea harvested all over the world. So sir is asking that why is that so easy to do, and why we can, advocate for it. We advocate intensely for it.
Because like many people can benefit from one corneal buttons.
What you showed in the video was probably applicable to other organ donations, where you asked not when the
Perfect match.
Yes, of course. It's not required.
Live donor, all those things are probably don't apply to cornea. Anyone can donate. It is the easiest thing to do. And anyone who is a close relative or who is the person who is responsible in the immediate aftermath of the death is the one who can take a call.
Correct.
You don't need any registrations, no commitments, nothing.
Correct. Yes.
Right? So no other thing, it's actually very easy to do. So when you do an educational video, I think you need to highlight these things more.
Yes.
Because this is a bit more complex. The one, if you've worked in a general hospital, you know this Jeevasatra and all that. It's a very, very complex process for organ donation. Whereas the eye donation is the simplest thing to do.
Yes, sir.
Factually, the way you put your video, I'm sorry, it's different. I don't know.
Okay.
I'm talking out of turn.
Can we have
We will definitely
Chandler team
incorporate
get
it in
ready to
one
come
more,
over?
Reel that we will actually be posting.
And we have a small announcement to make. There is a Volkswagen Polo blue color, KA03NH2092, that's blocking the way. So if it belongs to anyone here, please go immediately and move it out. Yes, otherwise it will be... It'll be sold. It'll be sold.
The best is, or we'll give it as a first prize for the champions. Yeah, it will be the triathlon first prize. Yeah, next one. Next is Team Chandlers. Thank you so much. Please give a big clap for them.
Okay, this is the last team, Team Chandler, and the topic that they were given was, patient education video on childhood myopia. Could you, introduce yourself?
I'm Dr. Shivani.
I'm Dr. Supriya.
I'm Dr. Pooja.
I am Dr. Abhijit.
Can we have the lights off, please?
What is childhood myopia? In normal patients, the parallel rays of light that come from the infinity after passing through the cornea and lens get focused on the retina. However, in patients with myopia, it gets focused in front of the retina. This image shows what a normal child sees versus how a myopic child sees. What are the causes of myopia? Increased screen time, lack of outdoor activities, not using the prescribed glasses, and also genetic factors. How do we prevent childhood myopia? Increased outdoor activities, low dose atropine therapy of 0.01%, myopia lenses to prevent progression of myopia. So this is the myopia clinic in our center at Netradhama Super Speciality Eye Hospital, Jayanagar, where we evaluate patients with childhood myopia.
Yes, what are the total difference compared to other videos?
So we made it more engaging, and it's basically childhood myopia. So for the parents, we are in like explaining to the parents basically how childhood myopia is and what are the causes. So in simple language, we have explained about it, sir.
We found participants in all the other videos except in this video. We found all the participants in all the previous videos except in this video, where we were searching that, okay, now they will come, or now they will act, and now they'll say something or do something.
So that makes us unique.
Yes, copyrights and other declarations.
So no financial interests are involved in this, sir. We edited this in InShot app, that too not premium one. Music is without copyright, and that one video we have taken from the non-copyright one in YouTube, and the pictures are from Google.
Weren't you mentioned about not mentioning the hospital name and other things? Two
So
times
actually
happily,
we have
thoroughly
one-
it has been mentioned.
So actually one other video we have given, but I don't know the second video, we don't know. We have just given the one without the hospital name.
could have picked
The
it,
last
picked that
date
only.
was 18th, right? We asked you that you can modify, but your last date was 18th. And we had a Zoom talk with you guys where we told you very clearly, you cannot say it's a technical glitch.
You can pick it up. You have it right now here. Whatever the unedited thing or whatever it is.
Voiceover, sir, we had already given that time name is there. Last, we are not mentioning the name. That video will be there.
You could have played that only. Now, what's the problem?
This one,
Okay, no worries. Just asked. Anything else you would like to say to give you the prize?
I have decided now something. So
Childhood myopia is very prevalent now. So I feel this video is very important, especially in Insta Reels, in the education aspect.
You have displayed the name of a drop and a drug. Okay, which is going to land you in soup right now.
not only the hospital and the records, but other things also.
Actually, this childhood myopia, for some reason, I think we would have liked it better if you all had not used the Caucasian population. We are so deprived of studies because majority of the studies have been done on those populations. So that is something you will feel when you go into practice. You will look for Indian studies. So miss the point there. And harnessing a video is very easy. YouTube download and you have the video. So I think to emphasize on your creativity, and childhood myopia is not just this. The family will know sometimes that I am myopic. I know my difficulties. Sometimes you get informed patients. They would have done their literature review at tertiary centers. So for such population, and childhood myopia will progress very fast. She'll be a 5-year-old who enjoys reading. So it is a good video, but I think if you were to see a clinical case, you'll be better able to portray it. From a resident's point of view, it is still work needs to be done, but good one.
Thank you. Give them a big clap. So I think with this we come to the end of the Boss Insta Reel. The Insta Reel results will not be announced today. It will be only announced tomorrow because already the quiz results are out. So if the Insta Reel results are out, you will come to know who are the champions because it will be an average. So we are not announcing the winners of the Boss Insta Reel nor the talent show. The whole thing will be announced during the inauguration when the final prize will be given. Is that okay? Yes, and I would like to thank all the judges for being so involved and so meticulous in their judging and the questions. Thank you really for all your time. Thank you everyone. Request everybody to go to Hall A for the talent show. Please encourage all the postgraduates, please.